My name is Dr. Rupa Joshi, and I'm a GP working at the Woodley Centre Surgery in Berkshire, near Reading. And we really wanted to know, how do we reach out to our patients? At the time of COVID, obviously it was very frightening and isolating, and for our patients with chronic conditions. They were cut off from a lot of their normal support networks. And also, we did notice a drop in GP calls, and I think that was purely because our patients were being very kind to us and didn't want to disturb us when they thought that we were overwhelmed and busy with COVID. So it was a practice-wide approach. We asked members of our team, we have twice daily huddles, and we asked the members of our team, what do you see a lot coming in? What's coming in through the door, through the triage calls, which cohorts of our patients need help. We also organised our training, and we had twice weekly meetings with the virtual group consultation team. We did some ideas generation of what we think would work well. The overwhelming response was really that anxiety was something that patients were ringing in a lot, due to the fact that they were worried and frightened of what might happen if they caught COVID. Patients that were self-isolating were concerned financially and about being away from friends and family that would normally support them. So we have now done 2 sessions of anxiety, joint with talking therapies, and our social prescribing link worker and our health coach who's been employed to help us with virtual group consultations. The first virtual group consultation we did was reaching out to our asthma patients, because we knew asthma worked. We had excellent outcome measures, and we had reduced hospital admissions and attendances to the surgery by doing our paediatric asthma clinics as face-to-face group consultations. So we knew that worked. So we thought, well, let's take something that we know works and we've already used in the surgery and turn it virtual. We did a patient search of all our asthma patients, particularly targeting those patients who had been in hospital within the last 6 months, who'd had 3 lots of prednisolone within the last 6 months, patients on the shielding list. And we also did a search on all our patients that were on 3 asthma medications or more. And we had a very good turnout. We had an excellent group consultation. And lots of questions were asked, and we discussed shielding, and we also managed to do peak flows and complete asthma care plans, and ask patients about their inhaler techniques and so on. So we managed to complete a whole cough asthma review, annual asthma review, in that group consultation, as well as address concerns on COVID. We focused on you have asthma and there's COVID everywhere in the community. Now what? How do you optimise your treatment? How do you feel confident that you are able to manage this situation? We also talked about, how do you spot the difference if you have an exacerbation of asthma or you have a COVID infection? How do you know whether you've got COVID or not? And if you do get COVID and you have asthma, then what? We talked about the services available, the treatments, our hot hub, for example, and what to expect if your GP triages you to the hot hub. Things like, everyone will be in PPE, wait in your car until you're called, you'll be asked to wear a mask, so that our patients can really visualise what's going to happen. They feel reassured that there is something available for them. They're not going to be left in the lurch, and also that there will be some protocols, and it's less scary for them knowing what to expect should the time arise. And I think patients did find that extremely comforting to know, what was in place locally for them, so should they need it, and that they would be well looked after. We also gave them some statistics on ITU admissions and our local trust, the Royal Berkshire Hospital, and what the status was like and what was actually going on a day-to-day basis, which the more information you have, the more empowering it is for patients. And what I see as a virtual group consultation is really to really empower our patients so that they can have that knowledge, that information that they can then use to help with their long-term conditions and help plan self-care, and provide them with a network of care that they feel confident to be able to access.